Primarily, we're calling for an integrated governmental response to maternal mortality, but also to the access barriers to early antenatal care, especially prioritising the Department of Health, the Department of Transport, Department of Basic Education, and specific recommendations also to the Department of Social Development. When we undertook the research, we were fortunate to visit women and girls in their homes in KwaZulu-Natal and in Mpumalanga. And in many of their homes, we saw high levels of poverty, causing a lot of hardship for both the women and girls and their families. When we visited households who had to pay enormous amounts of money to get to the hospital in order to ensure that their daughter or wife was able to have their baby in a healthcare facility. And when they described what that meant for them, that was very hard. So, for example, in one family, a household of 10, the mother, who was in her late 40s, was the only person who was working. When her young daughter went into labour, who was in her early 20s, it cost them 900 Rand to get her to the hospital in order for her to have a baby in safety. That meant that the next month, the household income, which was under 1,000 Rand, was spent paying back the loan that they'd had to access in order for her to get to the hospital. So one of the things that we found deeply shocking and worrying when we spoke to women and girls was when they described some of the challenges that they have encouraging their partners to use condoms to protect them from HIV. And also the fact that they highlighted that this difficulty was made worse during pregnancy, both because the importance of using condoms was not understood once somebody was pregnant, and also because they became financially reliant on their partners during that time. It meant that they were less able to advocate, and they described these challenges for them, both fearing being abandoned during pregnancy, which was a concern raised almost among all of the pregnant women we spoke to, but also of the consequences for them in terms of their financial well-being and their ability to access healthy food and other important essentials during their pregnancy.